Okay, well, welcome. Hello, everybody. My name is Stepan Jurajda, and as the former director of the Economics Institute, the host institution here, let me welcome all of you here for today's lecture and panel discussion. This whole event is part of the IDEA think tank of the Institute, and therefore part of the Strategy 21 of the Academy of Sciences, the strategy for the 21st century. And before I hand it over to one of the co-organizers, one small change in the program. Unfortunately, the Minister of Labor will not be with us today due to other pressing commitments, but she'll be replaced by a director of this section on family policy, Mrs. Sokachova. So with that, let me hand it over to Stepan.
Hello, welcome everyone here. I'm speaking on behalf of the organizer of this event, Platform for Social Housing, and we are very happy that Dennis Culhane agreed to give a lecture on ending homelessness and how his research in homelessness data influenced the politics in the US for ending homelessness. We are very inspired by Professor Culhane's research, and we are trying to take a lot of what has been done in ending homelessness in the US to the Czech Republic. So we initiated the Brno Housing First project, and now we are working thanks to Social Innovation Scheme of European Structural Funds. We are working with cities on integrated systems for ending homelessness on the municipal level. I hand it to David Kutzman, the moderator of the event.
Hello. Yeah. Oh, hello and welcome. I'm glad Stepan clarified one detail, that I am indeed not Dennis Culhane. Dennis is sitting over there. I've been just asked to chair this event. I hope everyone can hear when one is talking to the microphone from here. Oh, I can hear myself now. This is much better, I guess. Excellent. So, without further ado, just in terms of the program, we are going to hear Dennis's presentation, paper, lecture. That shouldn't take more than, say, 35 minutes, after which there will be a quick round of Q&As, 10-15 minutes, let's say, just to clarify, perhaps, whatever needs to be clarified. And then we will have a panel discussion, for which we have 4 distinguished guests. Their names you can see here. It's Martin Lux from the Institute of Sociology of the Academy of Sciences, Stepan Jurajda, whom you have heard just a minute ago, Vít Lesák, the director of the Platform for Social Housing, and Linda Sokachova, who is heading section for family and aging policy, as well as subsection for social housing and social inclusion, if I'm not mistaken. Anyway, my name is David Kutzman. I'm from the Institute of Sociology of the Academy of Sciences as well. Now, but why are we here? We are here because it is a tremendous pleasure to welcome here Professor Dennis Culhane. Now, his CV has over 30 pages, so forgive the brevity of a very short introduction. He indeed is one of the most prominent academics in homelessness research and policy responses. I believe Dennis has a PhD in social psychology, and ever since 1990 or so has held various faculty appointments in psychology, social welfare policy, social policy, public policy, mostly at the University of Pennsylvania or thereabouts, the East Coast that is. Most recently, indeed, he has held the Dana and Andrew Stone Chair in Social Policy. Outside academia, since 2009, he's Director of Research at the US Department of Veteran Affairs. Among many of his accolades, we may mention the 2012 Meritorious Service Award by the Coalition for Homeless Veterans. In terms of research, you all are familiar with the various research projects, mainly into service use patterns and costs, evaluation of rapid rehousing program back in 2015. For the past 16 years, he's been leading on the annual homelessness assessment report to Congress. Recently, he's done some work on actionable intelligence for social policy, which in other words is how to use integrated data systems to inform policy. Okay. All right, thank you, Dennis.
All right,
Thank you.
Thank you, David. Well, thank you for having me. It's a great privilege to be here. Obviously in a space so grand, not very used to this. But I also am a little uncomfortable. I think that with all the bluster that's coming out of the United States these days, the last thing you want to hear is an American come talk about social policy. I have to say that it's such a relief to be outside of the United States for a little while. So, forgive me if I take advantage of your attention to take a break myself. The presentation I'm going to provide today is going to show you some results from a series of research projects that I've done. And I'm going to do it chronologically because it sort of tells the story of the knowledge we got about homelessness and then how we started to rethink our approach and to some pretty positive effect at one level. Of course, there's other levels to this problem that we're not impacting, but we can talk more about that. The sort of the organizing method, if you will, for the work I've been doing has been to use administrative data, primarily that which tracks shelter use, homeless shelter use, okay, to understand the dynamics of the population. Now, how did this happen? Back in 1990, when I first started at the University of Pennsylvania, I was part of a research center that was studying the dynamics of schizophrenia treatment using medical records to understand how people were, experiencing crisis and hospitalization, etc. And it gives a longitudinal picture, if you will, of the population. And we didn't have anything like that in homelessness. Everything in homelessness was a cross-sectional snapshot of the population, a very static picture. And that was all we had. And our basic knowledge and stereotypes about homelessness was that you basically have these people who have a hard life, they fall into homelessness, they stay there, and they never leave, and they just accumulate, okay? But that was all based on a static picture that we had as well. So our stereotype and the data was all pretty static. And I went to lunch one time in 1991 with the person who ran homeless services in Philadelphia, and she told me that she knew that they served 16,000 people that year. I said, how do you know that? She says, we have a data system, and we register every person who comes into the shelter, the day they enter, the day they exit, characteristics, name, identifying number. And I was like, wow, that's amazing, you have this data. And it was not designed for research, of course. But lo and behold, I found out that there were 2 cities in the United States that had this kind of data, New York City and Philadelphia. And I went and got permission from both of them to get copies of their data and to analyze the picture of the population. That was when the privacy rules for sharing data were less strict. So basically, I'm going to show you about 20 years of research based on analyzing those data sets. I took the first thing we did was just how many people unduplicated are seen in homeless services. That was the first question. Then, what are the patterns of entry and exit and duration? And then we connected the homeless data to other data sets. Birth records, death records, health records, jail records, retirement and disability records, juvenile justice, child welfare. So you name it, HIV. We look to see about homelessness and these other systems and how they relate. So you can get a lot of publications doing that. So I'm not so sure the 30 pages is reflecting meritorious work, but you can do a lot when you have this kind of information. So that's basically what I'll be sharing with you today and how we learned something, hopefully, from that process. One of the first projects we did, as I mentioned, is we decided, well, let's sort the data using cluster analysis in terms of the number of episodes of homelessness and the number of days that people experienced this, right? Very basic idea. And there happened to be a typology that was out there and talked about about homelessness, but we didn't have any numbers associated. But people said, yeah, we have long-term homeless, we have short-term homeless, and we have a group that's in and out over time. So we applied a 3-cluster solution to the cluster analysis, and indeed, of course, it yielded something that was very similar to that. This bar on the left, the red bars are the percent of people in each of the groups, and we label them crisis homelessness, episodic homelessness, and chronic homelessness, and it's roughly 80-10-10. Vast majority of people are not homeless for long periods of time. They're, in fact, homeless for very brief periods of time. Over here is the basic statistics. So the average person, so 80% are in this crisis category. They become homeless once for an average of 3 weeks, and they leave, and they don't come back into the system, okay? And this was a revelation no one really thought, because this population is largely invisible to the providers because they're hardly distinguishable from the housed population, okay? And then we have the group that comes in and out. They would come in 4 or 5 times. By the way, the observation period here is 3 years. They would come in 4 times and stay an average of 2.5 months. This group we knew included a lot of the people who lived outside most of the time. They were coming in when it was cold, or the weather was really hot even, or if they were sick. And then we had this last group, the chronic homeless population. They're coming into shelter also an average of 1.5 times, but they're staying for hundreds and hundreds of days each time they come in. And that's what caught most of the policymakers' attention, because I was focused on demonstrating, most homelessness is among people who are experiencing a short economic crisis, which is an interesting fact. But most of the people in policy focused on the blue bars, which is if you take up the total days in the shelter system and add them up, what percentage of the days are used by these groups. And what you can see is half of the total spending is on this relatively small group of 10%. So a really small group using half of the shelter resources, okay? Effectively living permanently in the system. So if you had a shelter that you were running, half the beds on a given day would be occupied by this long-term group. And these cost about $25,000 per bed per year. So it's a very expensive form of permanent housing. And it's in a cot that's only 20 inches from the next cot. Okay? So it's not good housing. It's not cost effective. It's a huge burden, in fact, in many respects. And the people's quality of life is terrible because they have to leave at 7 a.m., spend their whole day outside, come back at 7 p.m., and don't get in trouble out there, okay? So people said, why don't we just convert half of these beds into housing for half the price and reduce the problem by 50%? That was the basic argument that came out of this. But of course, it's not that simple because there's different funds that pay for shelter and then pay for housing. You can't just take the money from one and put it into the other. It's way more complicated than that. In terms of the characteristics, what we saw is that as you go from this crisis to episodic to chronic, they're more likely to have a severe mental illness or any kind of medical disability, a substance abuse problem, or any one of those. Okay, so kind of predictable as you might expect. The biggest project that we did back in the late 90s, around 2000, because the largest intervention, in part based on this research, but advocacy and other groups were pressing the city and state of New York, which had the biggest problem at the time, to develop supported housing. And they asked me to do the evaluation, so it had to be a quasi-experimental study, and it was retrospective. So they'd started this intervention in '92. We came along in 2000 and gathered up all of the data. And we had about 10,000 people in the study, 5,000 of whom got into the housing, 5,000 of whom didn't get in. And we used a propensity scoring match as the way to identify the control group. Okay, so they were similar in terms of age, race, sex, psychiatric disability, duration of homelessness. Okay, and what we did was we matched up the data of the people who got into the housing across these 8 different departments. So the shelter department, the the psychiatric hospitals, the public hospitals, the private hospitals paid by Medicaid, outpatient services, our veterans hospitals, and the city jail and the state prison. Okay, so 8 different data sets. And what we learned, when you add up all of these, take the number of days they spend there, the cost per day, and annualized cost, you see the bottom number here, 10,000 people were using an average of $40,000 a year in services across all of these systems. That would be 800,000 krona, if I'm not mistaken, something like that. And this is in $2,000, so it would be more like $55,000 today in the United States. Okay, so that was a big number, because after that $40,000 of public taxpayer money is spent, these people are still sleeping on a cardboard box or in a shelter. Okay, so that's not a very good use of public resources to have people just rotating through all of these systems. But if you had only looked at one system by itself, you would not have said it was very astonishing. But when you add it all up, you could realize that basically every 3 days, these folks are using a public service at fairly significant cost. Okay, so this was eye-opening in some ways. Then we looked at the 5,000 people who got into the housing and compared it to the 5,000 who were still homeless and adjusted to see what the cost offset was. And what you see here is that people were less likely to stay in shelters, less likely to be hospitalized, less likely to be arrested, go to jail. If they did get arrested, or if they were hospitalized, they didn't stay as long because they could be discharged to a home. And if you added all of that up, you see that we have about, at the bottom here, $16,200 in reduced use of these services. Okay, because they're not running, they're not just bouncing around between all of these institutions. And so when you compare that to the cost of the housing, the savings, the offsets on the left-hand side, $16,200. The housing costs $17,200. So the net cost from a taxpayer perspective was about $1,000 per person per year. Okay? And we've gotten more efficient, by the way, at doing this, so the actual annual price is now down around $15,000 per year. The other thing is that we did not include some expenses that otherwise could have been captured. But basically 95% of the costs are offset by the housing. This study has been replicated over 50 times throughout the United States by researchers who are sophisticated, and probably the most famous was 2 police officers in Reno, Nevada, did their own little study about one guy and how much money they'd spent on him. It was called $1 Million Murray. And it's an article by Malcolm Gladwell, who's a very famous American nonfiction writer. The other thing, though, the other studies that were done, the biggest category of funding we did not include was emergency medical transport. or ambulance, I don't know what you would call it here, but that costs about $600 per ride. And these folks use a lot of emergency medical transport services. And had we included it, we most definitely would have found that there was a positive return on investment in terms of the public expenditure here. So, like I said, we did that study in 2000, 2001. The Bush administration came along in 2003 and proposed that they would set a goal of ending chronic homelessness in the United States, focusing on that long-term group. And they asked what would it cost, and I was not the person that was consulted, but the advocate said it would take $500 million in new funding. And so what they did was they added $100 million to the budget every year for 5 years, so that by 2008, when the Bush administration was leaving, they had added $500 million annually to that budget, and it produced about 50 to 60,000 apartments targeting chronically homeless people. And when we started, there were about 150,000 chronically homeless people in the United States at that time. So this was a significant investment. And then the Obama administration continued that effort. I'm going to say more about this in a minute, but I just wanted you to know that they continued this, but focusing on veterans who were in the homeless population. And they added 80,000 permanent supportive housing units to that pipeline for people who were chronically homeless. And that was about $1 billion increase over what was being spent previously. So I can say more about that in a second. But the numbers basically show, now we only have the tracking data from 2007, because that was the first year we started this annual homelessness assessment report for the Congress. And we have about a 30, now if you track this forward, this goes to 2015, but if you take it out to 2017, we're at about a 37% decline in chronic homelessness since 2007. If we were to go back to the 2003, we're probably definitely at least 60% lower than we were in 2003. So there's been substantial progress. We now have about total, so I gave you those two initiatives, but I think the total number of permanent supportive housing units now in the United States is around 270,000, 280,000 units. So there's been investment from a number of different sectors. And our veteran count, as you can see on the left-hand side, when we started the initiative in 2009 under President Obama, we were at about 75,000 homeless veterans. And here it says 47, but we're going to release the new data from 2018 in about a month, and it's going to show we're down to 37,000 in terms of the number of homeless veterans. So we've cut it by about 55% as well. But on the right-hand side is the amount of spending. So you can see there's a relationship in the slopes there. Okay, so I do want to say that, so this was all the focus on chronic homelessness, which was the thing that appeared sort of most obvious from the initial research. But like I said, I was more interested in the argument that most people who experience homelessness are not chronically disabled and living on the street for long periods of time. Mostly it's a short-term economic crisis, and we don't have a safety net that's protecting people with short-term economic crises, and they're ending up destitute and at risk for all of these terrible things that happen to you if you're, become homeless. Suicidality, victimization, all sorts of things, arrest and incarceration and abuse by police and thugs and whoever. So I was interested in saying, well, how would we better serve this population? And we don't come from a country that provides a strong social welfare support system like yours. We don't have universal entitlement to all sorts of benefits. So this was our way of putting our conceptualization around it. And basically said, like most social insurance programs, we would want to design a system, if we were to step back, where we had the highest volume of users was using the lowest cost per case intervention, and you would want to reserve your high cost intervention for the more complex cases who are fewer and more difficult. So that was the basic idea. And within homelessness, we sort of see those as homelessness prevention is our high volume, low cost service, and supported housing is our low volume, high cost service. Okay, so we're trying to think, oh, how do we put these things in a framework? And then we have our shelter system, which occupies sort of a middle ground there. Okay, people who homelessness doesn't get prevented, they breach into the shelter system, but being homeless in a shelter should not be an indefinite sentence to nothingness. The idea is it should be a time-limited intervention with an expectation that you can get out of there, and if you can't, then you go back into the mainstream supported housing idea. So that was our conceptual framework, and we knew there was a lot of things going on in the community that were doing homelessness prevention. But what we realized was there was nothing going on here. If this is the system as it operates, why do we have such a problem of all these people who are falling into homelessness and they get stuck there, and some of them self-resolve, but a lot of them are stuck there? Why is that? And it's because we don't have a specific service, which I affectionately will call the green box, okay? But we didn't have a service where there was a group of people whose job, they were paid to resolve your housing crisis. Everyone was being paid to provide you a bed, a meal, a place to stay, keep you safe, but no one was actually charged with helping you solve the problem that got you here, okay? It was not treated like this was a crisis that needed an intervention. It was like you went to the hospital, instead of going to the emergency room where they stabilize you and send you home, they said, okay, just come into the hospital ward, we'll put you in a bed and stay there, and let's see what happens. That's what was basically going on. So we created, this is the thing that we created in 2009 on a national basis in the United States, was a new service whose focus was, if you come to the shelter door to try to divert you immediately, relocate you, or help you with some temporary rental assistance. So a team of people whose job was to connect with landlords, to mediate crises with family members, to give you emergency cash assistance, help you resolve debts if you had some unpaid debts, but basically try to restore you to a basic place. And that's what we did. So if the prevailing model had been you would go into a shelter and maybe access other services through it, our new model was to put housing stabilization, which is our goal, at the very center of what happens to you. You may need shelter, you may need other things in support of that goal, but if the homeless system can't solve your homelessness, we're not going to solve every other problem you have. And essentially, we had believed that homeless service agencies could solve mental illness and substance abuse and all these other things, but of course, they can't do that. All right, so just to go into this crisis homelessness and why it's so important. Basically, the majority of people who are homeless in our country are experiencing this kind of homelessness, and there was no services for them, and the chronic homeless services weren't appropriate. On a given night, it's about 300,000 people who are in this situation, and about 750,000 over the course of a year. And I break it out here by families and singles, but basically the white is the crisis homeless population. And what's relatively unique about them compared to families is that about 1 out of every 4 is coming from an institution. And I'll break that out on the right-hand side here. So you can see here's the institution, they're coming from here. Most are coming from family and friend arrangements, but if they coming from an institution, they're mostly coming from a jail. Local jail, and if not jail, they're coming from detoxification substance abuse services, okay? So basically, the shelter system is acting as a place for people to go once they're just coming out of jail or coming out of detoxification. And so we basically created what is a crisis homeless intervention approach, which has both prevention and what we call rapid rehousing. I can explain in a minute about how that works because the one place we took this to scale, the one opportunity we had, was through the Veterans Initiative of the Obama administration. President Obama said, there should be no veteran homeless in the United States. The secretary, our minister of the VA, said, that's going to be my #1 goal. The Congress said, we will fund it, but you have to tell us what to fund. It was easy enough to think about the chronic homeless piece, but this didn't exist. So we said, let's create a new prevention and rapid rehousing service. And we had to estimate how many people we thought we should serve, and we said 150,000 people a year, basically. And so we got $350 million annually allocated to this purpose, and we launched a national program. And indeed, it serves about 150,000 people a year, mostly single adults, mostly males, okay? The group that many thought could not be helped with these kinds of programs. And it's been really remarkable. Just to show you, this is the rate of retention in housing from the prevention service. After a year exiting the program, about 10% of the singles and 6% of the families have returned to homelessness 12 months after they exit. By the way, what is this intervention? It provides up to $3,000 in debt relief. Okay, so you come in, if you have debts, we can provide up to $3,000 in writing checks to people you owe money to. Or if you need new housing, we do first and last month's rent and security deposit, plus up to 9 months of additional rent. So it's basically 12 months of rental assistance. We do mediation between family members and the person, or landlords and the person. We refer people to mental health and substance abuse services that they might need. And we have referral to special veteran jobs programs, places that place people into employment. And it works incredibly successfully. And the people who are in the program love it. The people in the field who work in this space really like this work much better than running shelters. And this is the rapid rehousing. Retention isn't quite as positive, but it's still 85% a year after exit on the singles and 10% for the families. So basically I'm sort of wrapping up with the picture. It's definitely not rocket science, but hopefully it's decent enough social science. And just trying to apply a basic understanding of this population, and social policy is fairly crude implement, so we have to come up with basic buckets of people and ideas to serve them, and that's what we've done. But I thought before I would conclude, I always want to make sure people know an interesting demographic fact about homelessness that we have observed. And that is that our adult homelessness problem is a birth cohort phenomenon in the United States. And it's a very pronounced birth cohort phenomenon relative to, say, the baby boom in general. It's essentially the second half of the post-war baby boom. People born between 1955 and 1965 who account for the majority of the adult homeless population. And that was true in 1990 when their modal age was in the early 30s, late 20s, early 30s. And it was true in the 2010 census when their average age was modal age was 50, okay? And in 2020, it's going to be 60. And their life expectancy is 64. So you can imagine what's basically happening is this huge, large group of people who has been susceptible to homelessness over the last 30 years in the United States is about to die off, basically. Which is we can talk more about where it's come from, but it's described as an Easterlin cohort effect. And effectively that, the second half of the baby boom was crowded out of the labor market, crowded out of the housing market, higher housing prices, lower wages, more unemployment, excess labor supply. And these folks got in their 20s, if they didn't get into a job, they got in trouble. And so we had the crack cocaine phenomenon of the 1980s that a lot of these folks got wrapped up in. Addiction, incarceration, family disruption, homelessness was part of that mix. And these folks for 40 years have remained troubled in many respects, certainly very vulnerable. And we do see, by the way, I was going to mention, we see an emerging millennial generation cohort effect that's starting to show up. Indeed, this year in New York City, the largest group of people in every 5-year birth increment will be people born between 1990 and 95. They will be the largest sheltered population because mortality is impacting the other group. So we have a question in the States: is homelessness actually a birth cohort phenomenon, going back to Skid Row and going back to other periods of time, that we're only just now recognizing that the baby boom and bust cycle that has gone on for so long is negatively impacting people born at the crest of that. And we're projecting their healthcare costs to be significant as this group ages, and we're having a series of discussions this fall in the US to try to figure out how can we address this aging and dying of this population, because it's a very large group and they're going to have a very big impact on hospitals and on nursing homes if we can't find housing alternatives for them. So that's the issue I'm focusing on most right now, and we'll just wrap it up there. Okay, great. Thank you, Stefan and David.
Well, thank you very much for that fascinating talk. I think it was going on 35 minutes. Oh, that. Well, like we said before, let's have first round of questions and answers from the audience for the next 10, 15 or so minutes, and then we move on to our panel discussion, which will sooner or later again open into a much wider debate, hopefully. So, questions from the audience. Well, in that case, I shall hand over the microphone to you.
Thank you. So one of the panelists, just so I'm wondering about the interaction of the secular trends in the decline in homelessness that you described in the demographic structure, the cohort structure, with the opioid crisis, right, with the deaths of despair. So on the one hand, I can imagine that to some degree, because hundreds of thousands of people have died because of this privatization of the healthcare system in a way. I'm using quoting Hilsey from this, but so to some degree, those are people who could have become homeless, and they're no longer around to do that. So I'm wondering to what extent that may have contributed to the decline in that 30% decline in homelessness that you documented. On the other hand, the crisis that goes along with this, for those who are still with us, may have contributed to the demand for housing support. And more importantly, perhaps, do you think that there is potential for another cohort, entering, with a high propensity for homelessness that's going to appear in your graphs now that we know that low-educated whites in certain parts of the U.S. do find it hard to, actually be, fathers to, and married couples to their children to even get married, let alone have jobs.
Right. Well, so certainly a part of the decline is attributable to mortality. So there's no doubt that if you're a betting person, you should bet on homelessness continuing to decline in the United States as a function of mortality of the main cohort. But these declines are more rapid than we would have expected by that, and those gross numbers don't adjust for that. Okay, so that's a point well taken. And we also see in our supported housing population that it's the same cohort effect. So they're still aging in place, basically. So they're not dying of natural causes as much. And the heroin problem, the opiate problem, was not as significant in this cohort. We're at about, I think, as I recall, it was about 5 to 7% of the adult homeless population in this cohort had a heroin addiction. Most of the addiction was cocaine, and especially crack cocaine, and methamphetamine. In the new cohort, at the VA, we do have a national healthcare system. I saw the most recent data is showing that the number of opiate addicted people in the homeless population is closer to 20%, okay, which is almost triple what it was, and that certainly seems believable with everything else happening in the United States. So it is a major factor, And it too could be impacting what we otherwise might have seen. You know, you could see that both negatively, reducing the number of people coming in because of death, or it's increasing them. I don't know which way it would go, but yes. And we are very concerned that the evidence all points to the emergence of a new cohort effect of people right now under the age of 30, but who are going to get progressively older. Yes.
Okay, thank you. Hope there's a note in black. Sure.
I have a question. I wanted to ask, what's the role of the Bay Area? You didn't mention, like you mentioned, a 30% decline in by-best knowledge in San Francisco area. There's been a substantial increase by 15% over the past few years. So, what's the problem with the implementation of the program?
So yes, the West Coast is completely opposite all of these trends. So even these declining trends in homelessness across the United States would be steeper if we didn't include the West Coast, because what's been happening is homelessness on the West Coast in the United States is reaching, epidemic crisis proportions. Tripling rate of homelessness in Seattle in the last 4 years. Big increase in Los Angeles. There are 34,000 people living outside of Los Angeles. So basically Seattle, Portland, San Francisco, Los Angeles, and San Diego are like off the charts in terms of homelessness right now. It's just really a striking problem. And what's particularly noteworthy is it's unsheltered homelessness, okay? Like 75% of the people who are homeless in Los Angeles are unsheltered. 70% in San Francisco. That means they're living rough outside, visible unsheltered homelessness. And that is, if you've been to the United States recently or traveled, this is what everyone talks about. People who live there, people who visit, everyone talks about homelessness every day because it's that profoundly in your face and in your life. It's very disturbing. Now, what explains it? I'm just going to say two things. First, explaining the unsheltered part. We're just wrapping up an analysis because, take a place like New York City. 95% of the homeless population is sheltered in New York City. Only 5% is unsheltered. Compared to LA, where it's inverse, 75% are unsheltered. So why so much more shelter capacity in New York, let's say, versus Los Angeles? Well, it goes back to history. There's actually a study that was done of public poverty relief programs in the 1920s in the United States. And this researcher has basically argued that there are 3 social welfare systems in the United States. There's the industrial Northeast and Midwest, which had the Industrial Revolution, generated a lot of wealth, a lot of philanthropy, labor organizing, a lot of Christian church organizations that were providing help to immigrants from Europe who were coming over, Europeans helping Europeans, and there was the building of a social welfare system akin to European standards. The Deep South was the newly freed slaves who were now being sharecroppers, and where there was no interest in providing relief to the poor people who were between seasons, let's say, in the agriculture. You want them to work for low pay, and there wasn't as much wealth. And it was definitely, there was racism, of course, of these being others, not Europeans helping Europeans. And on the Southwest and the West, it was Mexicans who were coming in on an annual basis for seasonal migratory work, and the states did not want them to stick around and provide relief to them after the season agriculture was over. They wanted them to go back to Mexico. So this led to 3 different social welfare systems that you can see very clearly by 1930. Shelter beds and cash relief available in some parts and nothing elsewhere. So fast forward to 1985, when homelessness is newly emergent in the United States, and you could go to a place like Philadelphia, and you could get 10 different organizations in a room immediately But you could say, hey, homelessness is growing, and they could triple their bed supply, and they had an infrastructure to build on. As you went to Los Angeles, you had the gospel mission. You had maybe a Salvation Army. That's it. They didn't have the history of this. So then the federal government runs a competition when they finally allocate dollars in 1990, and they're making a competition for these new federal programs. Well, who gets to apply? The organizations that are already there. So the Northeast and Midwest get most of the money because they apply and they have organizations to apply. So it's not until the late 90s when they go to a formula that places like Arizona and Texas and California are actually getting any of this new money. So they're already 15 years behind where these other, so as the problem, there was an infrastructure already. I mean, in New York and in the Northeast, they had already moved to the supported housing conversation by 1992, 93. And they were still not even having the shelter conversation in the West Coast and in the South, right? They were still having that problem. So it's a historical legacy that led to the sheltered versus unsheltered. But to your point about why has the overall level gone way up on the West Coast versus it's all about housing prices. These are the highest priced housing markets in the United States with very low vacancy rates. It's where the tech sector is concentrated, and there's tremendous migration to those areas for employment, and that's driving up the housing prices. We have a new analysis that's coming out that says that those markets that have average, where the median rent is over $2,000 a month, are the ones where you're experiencing this huge increase relative to other places. So it's basically, and by the way, a lot of these people are employed, okay, but they can't afford the market rents. And so they're living in, we have a new form of homelessness that we did not have 5 years ago on scale. People in tents, in campers, and trucks and cars. 2/3 of the unsheltered in LA are in a camper, a truck, or a car. But this is not a homelessness we're used to seeing. On this, I'm talking tens of thousands of people. So people basically saying it's cheaper for me to live in my car, cheaper for me to live in this tent than it is to stay in an apartment. And so, and also there's a contagion problem that when there's 100 people living like this in a park, it's a little easier to say, I guess I'll go pitch my tent there too. As opposed to if you're just doing it on your own. So you're part of a little village. So we have this encampment problem as well that's happening, that's very visible. I think I read somewhere, Seattle has something like 40 active encampments going on right now. I mean, so that's the opposite of the good news story I told you. That's also happening. Yes?
Isn't the difference between West and East Coast connected to this weather?
So weather, if you do a statistical model,
Yeah.
okay, weather is the #1 predictor of why you have unsheltered versus sheltered. But of course, weather is confounded with agriculture as well. And so when you include this historic variable for social welfare spending in 1930, it takes more than half the variance that's attributable to weather gets taken up by this historical social welfare. So yes, weather continues to be a significant variable, but much less important relative to this agriculture and social welfare variable.
And how it will be in the future with the changes, for instance, in agriculture, with global warming?
It's hard to know what the impact will be on homelessness of climate change. Is that your?
Yes.
Yes. So, you know, the homelessness that's created through natural disasters, like floods and fires and things of this nature, doesn't actually get counted as homeless in our official statistics. There's a different agency that deals with that. Just like with refugees, they're in a different agency. So we don't count them within the quote-unquote HUD homeless, if you will. But certainly there will be an impact. I could not predict, but there will be an impact, of course.
Thanks again. I have a question regarding data about migration of homeless people. Or like, is it like that when a person becomes homeless, do they stay in the city that they became homeless in, or do they migrate? Especially, I think in the West, like in California, it's the thing that people say that people only come to San Francisco that they didn't really become homeless there. So how is it with the real data?
Okay, so there's not one answer to that because it varies, but by and large, about 85% of the people who are homeless are becoming homeless in the locality they were living in before. Okay, it does not mean that they have lived there their whole lives, but they had some residence in that jurisdiction. Okay, and in fact, we did a study with the VA. We have national data, and we can see people moving around the country. And Los Angeles is actually a net exporter of homeless, not a net importer, okay? Because we see the movements around. Now, there are certain places like San Francisco that have a higher percentage are coming from outside. And we see homelessness pop up where there's industries that are growing like quickly. Like we have oil and gas exploration that popped up in South Dakota, or was it North Dakota? I don't remember which. But one year, suddenly the homeless numbers in Dakota went up like from 200 to 2,000. And it was because all these people had went there for trying to get a job in the oil and gas industry, couldn't get a job or were not skilled enough, and they ended up living in a Walmart parking lot. Multiple Walmart. Walmart lets you park in their parking lots and use their bathrooms. So these have become encampments that pop up of that sort. So there's some migration, but people are usually migrating for jobs. They're not migrating because, oh, it's nice to be homeless there. Of course, but every town thinks that their homeless programs are magnets, and that they're drawing homeless people in because we have such great services, which most people would rather sleep outside than use their services. But it's the mythology that seems everywhere to be held. I see a lot of shaking heads. Yes.
Okay. Can we say one last question about the state and then we move on to the next? If that's a question about the state.
Thank you for the lecture. I have a question about the positive part of your story about the new intervention, the new program. What was the motivation for the providers or the counties or whoever was responsible for implementing the new services to this prevention and rehousing? Here it seems like it's not so easy that everybody wants to do the new job, even though there is some funding available. So what was the...
Okay, yes. So it was new money. The new money, it was not taking money from existing services. It was a whole new. What happened was, so there was the veteran initiative, which, as I said, we went from a $300 million budget to a $1.6 billion budget. So it was a $1.3 billion, and so a lot of contracts, and a lot of people wanted that money. And so people were willing to shift what they did because that's where the growth was, okay? There was also simultaneous with that, we had the stimulus bill because the recession in 2009, there was a stimulus. How could we get money out to help low-income people and poor people? And we created a $1.5 billion national program of rapid rehousing targeting families. And so that was the first time that the whole country suddenly is like, what is this? And we can apply for that. And so people applied, and we had to do a whole training and develop materials, most of which we stole from European countries. And we did a whole deployment of this, but it was transformative. The whole field basically said, wow, we don't have to just run these shelters all the time. We can actually help solve people's problems. And it just created a whole new ethos that has been established and has really changed our field. But it took money that primed it and then changed people's behavior. And once people changed their behavior, they're like, this is what we should be doing. But people were resistant. Now, as time has gone on, as soon as the stimulus money went away, because that was just for 3 years, but the field wanted to keep moving in this direction, they had to start closing other programs and converting their money into these programs. That has been more difficult because people don't like to do that, but it has been working. we've been shrinking and shrinking our transitional housing and replacing it with rapid rehousing instead. So.